Good afternoon and Happy New Year. I know that when the pandemic started this past spring in 2020, we all hoped or thought that by the end of 2020, by the new year, we wouldn't be in this same position and that the worst would be over. But today, unfortunately, I'd be remiss if I didn't remind you that given the current state of the pandemic in Los Angeles County, the worst is almost certainly still ahead of us. As of today, hospitals continue to be significantly strained. All hospitals are being inundated with COVID patients. In our four public DHS operated hospitals, we have 557 COVID positive patients hospitalized as of this morning. This is the highest number that we've seen yet in the pandemic, and every day it just grows and grows. Over half of our beds are filled with COVID positive patients, and over 3/4 of the patients who are receiving critical care services in the intensive care units are there because of COVID. We are continuing to do everything we can to address the most constrained resource, which continues to be staff. I'm thankful for the support from the state as well as the federal government, including the deployment of federal staffing teams to come to 2 DHS hospitals as well as to several private hospitals in the coming days. We are trying to ease the amount of work that nurses need to do so that they can focus on patient care. And we are adding nurses wherever possible, looking to registries and contracts, as I mentioned, the Department of Defense teams, additional support from the state, and redeploying nurses, as I've spoken about before, to the hospitals wherever possible. To date, within DHS alone, we've redeployed over 800 nurses from outpatient clinics to our hospitals or to other critical areas such as the quarantine and isolation sites. And private hospitals, to the extent they can, are doing the same. Many hospitals have reached a point of crisis and are having to make very tough decisions about patient care. EMS is working with all hospitals across the region to relieve the pressure on especially the smaller facilities and seeking to facilitate lateral transfers to hospitals who are better able to manage the volume wherever possible. We continue, as all hospitals do, to care for many ICU-level patients in the emergency departments as patients wait for beds to open up upstairs. We are still encouraging people to only come to the emergency department or to call 911 if you have a medical emergency or psychiatric emergency. Ambulances are still having to wait many hours to offload patients to the emergency room, and patients should know that if they're not having an emergency, the best place to go to seek care is outside of the emergency medical services system. Call your doctor, go to an urgent care, or seek care through a nurse advice line. I am grateful to the participation and collaboration from all of the fire departments, both within the county as well as city fire departments, who are helping to triage patients on hospital grounds as they wait for offload. Law enforcement has also been instructed by the Department of Mental Health to bring patients who are on psychiatric 5150 holds who do not have active medical issues to go bring them to psychiatric urgent care centers rather than to medical emergency rooms. The volume being seen in our hospitals still represents the cases that resulted from the Thanksgiving holiday. We do not believe that we are yet seeing the cases that stemmed from the Christmas holiday. This, sadly, and the cases from the recent New Year's holiday is still before us, and hospitals across the region are doing everything they can to prepare. For those in our community who are fortunate enough to not be in a hospital, if you or your loved one think you need a COVID test because you either have symptoms or had a known documented exposure to someone with COVID, or just think you were exposed to someone with COVID, there is availability at the county-operated, city-operated, state-operated, and private testing sites across the county. We are testing more than 300,000 individuals each week and are constantly expanding with more pop-up locations, mobile testing capacity, in addition to the home test collection kits that are available by mail. Hope is on the horizon with the vaccine. In just DHS alone, we've vaccinated more than 12,000 staff who are on the front lines working in our hospitals. And hospitals across the region, despite being in the midst of surge, are doing the same to make sure that this protection is available to those people working on the front lines. And this is a big step in the right direction, but until we reach a point where there is widespread availability, and uptake of the vaccine, we need each and every individual to continue to take the situation seriously that we now find ourselves in across LA County. In closing, two things. First, please stay home as much as you can. Not everybody has the ability or the privilege of being able to stay home. Many people are essential workers and they have to leave their home to go to work. But many people do have a choice. And I ask that for all those who are fortunate enough to be able to stay home, that they please do so. Second, on a similar note, when outside of your home, please do wear your mask. I'm very saddened, as I know are others, by the escalating reports of protests about people not wanting to wear masks, about people who want to assert their right not to wear a mask, or those who foolishly say that they don't want to wear a mask because they aren't worried about getting sick. For those people, I would remind you, this isn't just about you. The facts are the facts, and they are grounded in science. Wearing a mask will protect you, but even more so, it will protect those around you. You may not be worried about getting COVID, and you may only know people who had a mild or an asymptomatic course of the disease. You may think that you're young and healthy and strong and that you won't have a severe course. You are lucky or fortunate or perhaps both. And you may be lucky enough that that will continue to hold true for you and for your family. But for some of you, this won't be how your future plays out. You will get sick. You may not recover at all. And if you do recover, you may have lasting consequences from this virus. But more importantly than that, wearing a mask is not a statement and should not primarily be considered a statement about how you feel about your own health and your own invulnerability. It's primarily a statement about how committed you are to protecting the lives and the health of those around you. This virus spreads easily and quickly. It spreads even when you don't know that it's spreading. So I'm not asking you to wear a mask to protect yourself. I respect that individuals can all make their own decisions about their own health. And if protecting one's own health is what this is about, then there wouldn't be a health officer order to wear a mask. It's not about you. It's about the other people around you. And in this time of mass crisis, we need to think of our neighbors. Please show others the basic common courtesy and take the life-saving action of wearing a mask when you're around others.
For more information, go to the website on your screen.